Basically, we are having four type of sulcus. Of that, the first one is the limiting sulci. So, the limiting sulci it separate two different functional area. It separate the two different functional area. For an example, the central sulci. You can see that the central sulci it divides two regions, that is as motor gyri in front and sensory gyrus behind. So the second type is the axial sulcus. In this axial sulcus, it is found in homogeneous area. It is found in homogeneous area. For an example, the post-calcarine sulcus. Post-calcarine sulcus in the occipital lobe, that is at the visual cortex, or you can say striate cortex. This axial sulci is present. The third one is the operculated sulcus. So the operculated sulcus, so it is same as limiting sulcus, but the wall and lip of sulcus it contains a third area. Lip of sulcus it contains third area. For an example, I will give you an example. So there is a sulcus which is dividing the area number 17 and area number 18, and it is having a third area which is area number 18. So the fourth type is the complete sulcus. So these the complete sulcus are mostly deep, located deep, and it will also give an impression. It gives impression in lateral ventricles. Impression in lateral ventricles. So for an example, the anterior part of calcarine sulcus, that is called as calcar heavis, and the collateral sulcus, and which is known as collateral eminence. So we must note that in the calcarine sulcus, we are having posterior part as well as anterior. So the posterior is related with the axial sulcus, whereas the anterior part is related with the complete sulcus. Now about the gyrus. So this is the central sulcus of Rolando. Central sulcus of Rolando. which is here this is anterior and this is posterior. In front it is motor and behind it it is sensory. This is the central sulcus of prolandon. In front it is the precentral gyrus. So this is the precentral gyrus and area number 4. It is a precentral gyrus. So this precentral gyrus, it is a primary motor area and it is area number 4. So here you can see two sulcus, that is superior frontal sulcus and inferior frontal sulcus, which is dividing into 3 gyri, that is this region, superior frontal gyri, area number 6, middle frontal gyri, this region, middle frontal gyri, area number 8, and inferior frontal gyri, that is area number 44 and area number 45. So inferior frontal gyri, this is a region Broca's area. This is the region of Broca's area and this is where there is motor for speech. Motor function for speech. For doing a motor function, the primary motor area is required. Whereas the superior frontal gyrus, it is also called as the premotor area. So this superior frontal gyrus, it is a premotor area, and for planning a motor movement, this premotor area is required. The middle frontal gyrus, it is concerned with the frontal eye field. It is concerned with the frontal eye field. Now, this is the post-central gyrus and this is the post-central gyrus and it is represented in the area 312. So this is the primary sensory area. It is a primary sensory area and you can see a sulcus here, that is intraparietal sulcus. This intraparietal sulcus, it divides the parietal lobe into, this is a parietal lobe, superior parietal lobule, this region, superior parietal lobule, and an inferior parietal lobule, that is these two regions. The superior parietal lobule, that is this area, it is concerned with the area 5 and 7. This is the region where there is sensory association area. Sensory association area. And the inferior parietal lobule, that is this region, it is coordinating the hand and eye movement. So it is coordinating hand and eye movement. So this is the temporal lobe. In the temporal lobe there is sulci. So these are the two sulci which divide into superior temporal gyri. So this is a superior temporal gyri, a middle temporal gyri and an inferior temporal gyri. So in the anterior part of the superior temporal gyri, it is concerned with the anterior part, it is the auditory area. Auditory area, it is concerned with 41 and 42. Area 41 and 42. And the posterior part, it is concerned with the Wernicke's area of speech. There is Wernicke area of speech, and the area is concerned with 22. That is the sensory part of speech. So this is the occipital, and so this is the occipital lobe, and this is concerned with the area 17, 18, 19, and it is concerned with the visual cortex. It is concerned with visual cortex. When we are taking the medial view of the brain, there is something called a cingulate gyrus. Above the corpus callosum, you can see the cingulate gyrus. So the cingulate gyrus is concerned with the brain's limbic system. It is concerned with the brain's limbic system. And there is a paracentral lobule. This is a paracentral lobule. This is concerned with it is a highest center for micturition and defecation. It is a highest center for micturition and defecation, and it is concerned with the lower limb and perineum. Lower limb and perineum. This is the uncus. Uncus. So this is the uncus of the parahippocampal gyri, and it is concerned with the olfactory area. It is also concerned with the limbic system, and the area involved is 28. So next, a few words about the motor homunculus. The area of representation depends upon the skills of organ and not the size of organ. For an example, if the hand is doing more skills, right? So the hand will have a greater area, and the area is represented in an inverted manner. Here you can see this is the medial side and this is the lateral side. The perineum and the lower limb is present towards the medial side, and you can see the hand, larynx, tongue, face, hand, arm, and it is arranged, the area is represented in an inverted manner. Okay. The most of the lateral part of brain, it is supplied by the middle cerebral artery. Middle cerebral artery. Most of the medial part of brain, it is supplied by the anterior cerebral artery, and the visual cortex. The visual cortex, it is supplied by the posterior cerebral artery. So if there is a lesion in the if there is a lesion in the middle cerebral artery, there will be contralateral sensory and motor loss of mainly the upper limb and face. It is because the lower limb and the perineum, it is towards the medial side, so it is supplied by the anterior cerebral artery, and there will be Broca's and Wernicke's aphasia. There will be Broca's and Wernicke's aphasia. So, if there is a lesion in anterior cerebral artery, there will be contralateral sensory and motor loss of especially the lower limb and perineum, because it is present in medial side. The anterior cerebral artery is supplying the medial side. If there is a lesion in posterior cerebral artery, there will be contralateral homonymous hemianopia with the macular sparing. Actually, the macula, it is supplied by the middle cerebral artery. So there will be sparing of macula. So it is homonymous because in our brain, this is a Broca's area which is involving in the motor part of the speech, and this is a Wernicke's area which is involved in the sensory part of speech, and it is connected by arcuate fasciculus which helps in repeating. So there are various type of aphasia, that is Broca's aphasia, Wernicke's aphasia, conduction aphasia. So if there is a person who is having Broca's aphasia, that is his motor part is affected, hence he won't be able to talk fluently, but his comprehension, that means when a person speaks, he will understand the things, that is his comprehension will be normal, because Wernicke's area, which is sensory, is normal, but there will not be repetition, will not be that good. In the case of Wernicke's aphasia, the interpretation, comprehension won't be normal, but the Broca's area is intact, so he can talk fluently, but there won't be any repetition. So in conduction aphasia, the lesion is present at arcuate fasciculus, so he can comprehend the things, that means he can understand the things, because his Wernicke's area is normal, and he can talk fluently because his Broca's area is normal, but he can't sing, that is he can't repeat, because there is a lesion in the arcuate fasciculus.